So that second connection is exactly the same thing. It's the mathematical accounting, and like I said, it's brilliant when you see it in live action of how we got fat together. So it works both ways, and hopefully what you can do is find ways to capitalize on the power of social networking to improve health behavior in your entire target audience. We have a wonderful speaker who's going to talk about social media and you know, the tools that you have at your disposal are really wonderful. These are very powerful channels for you to disseminate your message.
Good afternoon. My name is Braun. I'm the current director of the Center for Health Literacy at the University of Maryland College Park School of Public Health, the newest School of Public Health in the state. I'm also a professor in the Department of Family Science, and I'm more here to talk to you in this session about my research study that I have been a part of since 1998. 13 years ago, 17 of us from across the nation said, who is looking at rural health? And we found almost no one looking at rural health, and certainly not beyond the standpoint of large-scale statistics. What was the lived experience behind that? And so we launched a study called Rural Families Speak, which has been ongoing since then, with a theme and variation of what we've been looking at. We didn't begin to look just at health. We were looking at the total complex of one's life and discovered that health, and then there was everything else. Not surprising, probably. And then, so last year, we decided that we would focus on helping people to change their own health. Now, up to this point, we had been focused on policy, community-level policy, federal and state policy, and we'd had a great deal of success in influencing that. But again, from an ecosystem standpoint, that was really not quite enough. And up till now, we had felt like, well, it's the professional's job to work with the individual families. But what we were discovering was professionals said, but we don't know enough yet about how we should be communicating. So last year's study, it was funded by the United States Department of Agriculture, enabled us to look here at core health messaging. And we decided that we would propose that we would incorporate health literacy principles into this study. And the bottom line, if you only remembered one principle of health literacy, is that you start with the user in mind. And some of this that I'm going to say is actually ties to what you spoke about, Anne Marie. And if people have not studied adequately rural people, then maybe they are somewhat handicapped about knowing what might be the needs and interests of rural people. So we began with that. And our goal was to reduce health disparities, improve health and well-being among these rural low-income families and the communities in which they live. Remember, we are functioning originally in 17 states. This is a 14-state study, building on previous year's studies. We deliberately focused on ethnically diverse mothers. We have sampling targeting each of these 5 ethnicities in these 14 states. They have to be mothers with children from 0 to 12 years of age and an income of 185% or less than the poverty line. In other words, really specific, targeting who it is that we are focused on. We created some initial test health messages in the area of physical health, dental health, and food security, and healthcare reform, wanting to find out what did they know and understand about healthcare reform, as well as some of these other messages. And we used community forums, focus groups, individual interviews, and an extension education program to collect our qualitative and quantitative data. We are so immediately collecting this that what I am sharing with you today just got analyzed, and it is so primitive at this point that there's no way of knowing whether this is going to be what we will have finally found or not. But it at least illustrates to you what we are trying to find out, so that we're ready for phase 2, which is a further testing of messaging when it's actually delivered by folks like you. And that would begin to happen in Maryland and other states after October of this year. Our goal is that we would then learn from stakeholders like you what it would take for you to use previously tested messages. So, what would it take for the mothers to use them and respond and follow through using her stage of change type model, and what would it take for the stakeholders? We will be sharing the messages that were generated via a variety of websites and etc. And so today, you're just going to see a little bit of the results. We asked them questions about their own health and their health literacy. We asked them about their perceived control over their and their family's health decisions, the appeal of particular health messages, and preferences for receipt of health messages. And then we added a new creative piece, we think, in that they created their own message. After they'd gone through testing 3 versions of 2 messages, so 6 messages, then they created their own. And they responded to the messages using clicker technology. So a message would be put up there. They would, on a scale of 1 to 6, tell us what they thought of it. That would be recorded. The whole room could see it that way. And then a discussion ensued, and we would move on and we would move on. And then at the end, those findings would be summarized, and you could see, well, in this room, this is the particular voice that you preferred. Or in this room, you were split on the voice. In this room, this kind of appeal held for you. Now, take that and create a message for women, mothers like you, about physical activity. And that is another innovation that I have to share with you. Well, in general, they rank their health better than it probably would be rated if we used a more objective measure. This has held up now for 13 years. They're all healthier than they are once we go through an actual scoring of particular health conditions and all of that. So this is probably not quite as good a health as they actually have, but this is how they rated themselves using that standard scoring. How confident are you in filling out forms is the one question that can be asked to give an indicator of health literacy. It's inadequate, but it is an accepted measure. And strongly confident so far has come out here. About half of all the respondents say that. The lower it is, the more indication of having a health literacy problem. This is just too little of data at this point to even say if there's any validity to this or not. But we wanted to know both of those things because it would have effect on how you craft the messages. What they perceive their health to be, and then in our study we have the closer reality of their health, what they perceive their health literacy to be and what it might actually be. We also wanted to know how much time they had for themselves in order to put into place good health behaviors, and you see here overwhelmingly a little time. We expected this based on our previous studies. And then everything was on a scale of 1 to 6. How much control do you have on over your own daily life? And you'll see that there is quite a good amount of control that they say they have over their life until you listen to their story. And so you're only seeing some quantitative data. What we're analyzing qualitatively would tell you that they may be incongruent between a scoring and what their reality is. Here's a quote of one of the women who's talking about control, and she says she feels like she has no control, or maybe over the half of her life, and her kids are out of hand behavior-wise, indicating we might need to do some parenting education. Over her work and cleaning jobs, I have some control. I'm on a set schedule. I don't have to ask permission. I just go and do my thing and I'm good. But with the kids, they don't listen and my husband's no help. He laughs. This is just a little bit of an indicator of the complexity of some of their lives and how they perceive things to be. Then we ask more about their own control over making decisions about their own health, and you see here they actually are indicating they have more control to make decisions about themselves than they do over the control of their lived experience, which for someone wanting a health message to be heard and adapted could be a positive thing. How much control do you have over making decisions about your children? And you'll see here they have a little less in some regard. And when you listen to them, you hear, because in part it has to do with who's caregiving conflict within the family, especially intergenerational, about what ought to be done or not done. Some other things like that begin to come into play. A divide between doctors and real life was revealed in this particular quote that we pulled rather quickly. And I think it depends on health insurance as a matter of control. I know for me personally, I have a provider. There's a limited number of providers you can see and limited services you can receive. It all depends on how much you can pay for your copay, and if you can't, then you don't get services. I feel like I'm better able to advocate and fight for services for my children than I am for myself. That would be a common theme. Over the years, we've studied their food intake, and they almost always give up food for their spouses and for their children, and are more food insecure than the other two. How much should the message connect to my personal situation? There's your cram, right? And overwhelmingly, they want it to connect to their personal situation and talk about how a lot of the messages don't, in their perception, do not. How much should the message show understanding about my life? You see that that's really important to them, that in some way I'm acknowledging that what your life is like. Should the message include actual steps to take? Yes, and then there's these only if it's easy, so it's another yes, only if easy. So you don't want to get too complex, but you want to give them the steps. So not just tell them what to do, but how to do it. Would you rather learn about positive or negative consequences? That gets to your benefits. And you see here positive and both. So what I'm going to do is show you some examples of the messages. We had a set of 3 dental health messages, and we flipped around across the country whether they received them from simple to complex or complex to simple. And of the messages that they received, these 2 so far are holding as their preferred messages. The first one you'll notice is impersonal. It probably comes from some health professional, but this is where I'm going to differ with you a little bit. The majority so far of the mothers prefer to hear someone like themselves. So I think we have to all question, whether or not that assumption of it's always the professional. Maybe so, maybe no. This is not a big enough study yet to even, say that that's not true. But what you'll see in here then is these are very simple, straightforward steps in the first one. In the second one, you get this, I'm married, I have 2 kids, I'm always busy and pinched for money. That's a common theme of their lives. And I want my children to be healthy. I don't want my kids to have cavities like I did. Our dentist told me, so they are introducing an authority figure, that my kids might get cavities if they don't drink water with fluoride and use toothpaste with fluoride. I've been buying bottled water and toothpaste with fluoride to prevent cavities. So here's someone who heard a message, has acted upon the message, tells you why she's acting upon the message. This one was very well received. In the food security category, one about a grocery list to help you get through the month. And the very simple one is this first one. The second one here is a little more complex. Notice that the negative is introduced in the second one in the line, without a list. You may buy food that you don't want or need. So this one had the mix of positive and negative together. And then they began creating their own messages. They thought it was helpful to actually state in a message that it's easy to do the desired health action. And so this is one that they created about getting the kids to the gym. And they came up with this in about 10 minutes. So it's not polished, but it's an example of it. And they were beginning to get it, what these messages were about. We could tell when they created one themselves. Now, the last thing to share with you then is that we also ask them about their preferred order of receipt of messages. How would you prefer to receive it? And we've shown these to you in order. Again, very few people here at this point, but we are seeing kind of a split between the personal and the electronic. And so what we are planning to do this fall with the tested messages is to start delivering them by 4 methods that came out high. We don't know which of those will be yet because we don't have the data analyzed, but we will be doing that this fall. And I'm just acknowledging here the other institutions and states which were involved.